One bustling evening in the emergency room, the air was tense with urgency. A young man, not more than 25, stumbled in, his breath shallow, and his countenance ashen. Complaining of an acute distress in his chest, beads of perspiration formed on his pallid forehead. His symptoms eerily resembled those of a myocardial infarction, yet his relatively tender age prompted the attending medics to hesitate, deliberating the improbability. Dr. Ahmed, seasoned in the frenetic environment of emergency medicine, orchestrated the initial assessments diligently. An electrocardiogram ensued, yielding marginal perturbations that failed to rouse significant alarm. Parallel blood analyses also hovered within plausible limits, guiding the prevailing assumption towards transient anxiety or perhaps a muscular ailment. Nevertheless, a gnawing intuition disturbed the complacency of the diagnosis. A moment before formalizing the patient's discharge with analgesic prescriptions, a perceptive intern named Sarah discerned a subtle but perilous variance. The patient's oxygen saturation levels were imperceptibly below the normative threshold. Her astute proposal of conducting a D-dimer assay, though seemingly excessive at the moment, was heeded. The results, however, would soon alter the trajectory of the evening, revealing alarmingly elevated levels. The revelation precipitated immediate escalation, necessitating a computed tomography scan. It unveiled a substantial pulmonary embolism, a formidable adversary lodged within the respiratory passage. The gravity of the oversight was stark. Had the discharge proceeded, the night could have concluded in tragedy. Administering prompt anticoagulant therapy, the medical team fervently stabilized the young man's condition, steering him back to health. Dr. Ahmed, reticent yet reflective, later extolled Sarah's meticulous observance of what others deemed negligible, a testament to attentiveness that had fortuitously intervened. This narrative, though confined to the hectic walls of an emergency department, resounds a timeless truth. Minute anomalies may herald pivotal insights. An admonition to perpetually trust one's instincts and scrupulously examine each fragment of evidence, however inconspicuous.